Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at celiac.com. And now, let's move on to the latest Celiac.com news. The link between celiac disease and thyroid disorders, celiac disease, and thyroid disorders might seem unrelated, but research shows a clear connection between them. People with celiac disease are at a higher risk of developing autoimmune thyroid conditions like Hashimoto's thyroiditis or Graves' disease, and vice versa. Understanding how these conditions are linked, their overlapping symptoms, and how to manage them is especially important for those with gluten sensitivity or autoimmune risk. Celiac disease is a genetic autoimmune disorder triggered by gluten, a protein found in wheat, barley, and rye. When someone with celiac disease eats gluten, their immune system attacks the lining of the small intestine. This leads to inflammation, damage, and poor nutrient absorption, which can cause fatigue, anemia, digestive issues, and more. Although the condition is strongly tied to specific genes like HLA, DQ2, and HLA, DQ8, not everyone with these genes develops it, suggesting environmental and immune factors are also involved. The thyroid, a small gland in the neck, controls metabolism and hormone balance. Autoimmune thyroid disorders include Hashimoto's thyroiditis, where the thyroid slows down, and Graves' disease, where it becomes overactive. Symptoms can range from fatigue, anxiety, and depression to weight changes, hair thinning, and sensitivity to temperature. Scientific studies reveal that people with celiac disease are more likely to develop autoimmune thyroid disorders than those in the general population. This link is largely due to shared genetic markers and immune system dysfunction. Having one autoimmune condition often increases the risk of another. Once the immune system attacks the gut in celiac disease, it may also begin targeting other organs like the thyroid. Estimates suggest that 10 to 30% of people with celiac disease may eventually develop thyroid problems, especially Hashimoto's. Similarly, people with autoimmune thyroid disorders have an increased risk of undiagnosed celiac disease. One of the challenges in identifying both conditions is that they can present with similar symptoms: fatigue, brain fog, digestive issues, which can lead to misdiagnosis or misdiagnosis if doctors are only looking at one condition. Because of this connection, many experts recommend that people diagnosed with celiac disease undergo regular thyroid screenings. Simple blood tests can detect abnormal hormone levels or antibodies targeting the thyroid. Detecting these issues early can help prevent complications like infertility, heart problems, or long-term fatigue. On the flip side, people with thyroid disease, especially if they experience ongoing digestive symptoms, may benefit from celiac testing as well. Following a strict gluten-free diet is the only treatment for celiac disease. Some evidence suggests it may lower the risk of developing other autoimmune conditions. However, it cannot reverse thyroid disease once it begins. That said, for those managing both celiac and thyroid conditions, a gluten-free lifestyle may support overall immune health and improve symptom control. Managing both conditions requires ongoing care. Thyroid medications like levothyroxine need to be taken consistently, and dosages may need adjusting if intestinal healing affects absorption. People with celiac disease or gluten sensitivity should monitor for signs of thyroid imbalance, like unexplained weight change, low energy, or mood swings, and work closely with their doctor to catch problems early. In summary, celiac disease and autoimmune thyroid disorders are closely linked through shared genetics and immune responses. Their overlapping symptoms can make diagnosis difficult, but regular screening and early detection can greatly improve quality of life. While a gluten-free diet supports immune health, it can't cure thyroid issues. Staying informed, working with healthcare providers, and monitoring your symptoms are key steps to managing both conditions effectively. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.